Good morning. Hello, everyone. Welcome to Lifescape Premier Facebook Live. My name is Dana, and I am the Integrative Functional Dietitian here at Lifescape. And welcome again to this update. What I'm going to be talking about today is a few things to start off about COVID. Just some news that's come in I wanted to share. Dr. Wilder would like you to know about. And then I'm going to go into self-care routines for the soul and some things that you may have thought about or not, and we'll talk about that in detail. So for right now, I wanted to go ahead and start with the COVID updates and a couple of studies that have come out recently in two peer-reviewed journals. The first one is the Journal of Hospital Medicine, and the second one is Critical Care Medicine. And both of those journals looked at some studies that showed that there is an 18 and 20% drop in mortality in hospitalized COVID patients since March. And the reason why that has happened, they believe, is because of two things primarily. One is there's been an improved ability for physicians to treat COVID, and the other one is because they believe that mask wearing may have helped lessen the severity of COVID cases, so they're not dealing with the extremes as much as they were in the past. The other thing I wanted to talk about is there's some early data that shows that school openings in the elementary schools aren't necessarily driving outbreaks. There was some data evaluated in random testing from schools in the United States and in Britain that showed that elementary school children were not necessarily transmitting the virus at the same rate as adults or middle or high school age kids, and that they felt like the opening of elementary schools in a slow and safe and cautious way was probably more warranted. Another bit of news information is AstraZeneca and Johnson & Johnson have been pushing the vaccine trials, for those of you who have been following those. And they were paused for a brief time because two people were found to have, in the volunteers in the study, one was starting to show neurological side effects and another had signs of stroke. They've ruled out those symptoms as relating to the vaccine itself, and they've restarted the trials. So we'll see where that takes us over time. And then the final piece of update here is related to AstraZeneca, and that they have looked at some immune response on a cellular level of young and older children both responding equally well to their preliminary vaccine. And they're looking to publish those studies, so those aren't officially out, and hoping to seek some regulatory approval. So just a couple of snippets of updates some of you may already know and be aware, but moving forward, those are promising updates, and I like to give some positive news in this time of not always positive news, and know that there are people working towards the good of the greater community in our nations. And with that being said, it's a good opening to drill down into what I wanted to focus the most of our time on today, which is this idea of self-care. And I think that's the thing that we tend to throw out the window first when we get stressed out, and especially if you are helping other people in your life. It's easier always to help other people, I think, than to help ourselves. But if we help ourselves first, then we actually can show up better for those other people when they need us. So I want to break this down into two different buckets of self-care. There's what we do, routines around our health, self-care for our health, and that's basically to help us survive. And examples of those are the way we eat, so we can choose healthier or unhealthier foods and eating patterns, how we hydrate, how we sleep, what happens with our stress and our exercise. Those are all what I would kind of call the core healthy, core self-care health type of things that keep us surviving. But we really want to move on past surviving into this idea of thriving. And that is really the whole tenet behind functional medicine, and what we do here at the clinic is we don't just do the bare minimum, we go above and beyond, so we want to optimize. And so then we're looking at self-care routines that help us thrive, or that are in that second bucket, which is wellness. And that's where I want to go today. And I want to talk about 5 or 6 different areas that fall into that bucket. The first one is being mindful. And mindfulness is about bringing your attention to the present moment. And when you find yourself ruminating on the past or worrying about the future, you're not anywhere in the middle, you're in the ether. And so being mindful of going into those different states of mind can help pull you back into the here and now. And you can do that with everything that you do in life, how you make your bed. Any of you who follow Thich Nhat Hanh, he's a wise sage and talks about washing dishes in a mindful manner and embracing that opportunity. How you eat, how you think, how you move. All of that can be done with a sense of I'm here in the now, in this moment, doing this thing. And it can lead to a much healthier mindset and a much healthier brain. And what I would remind you to do is think about your words also in a mindful way, and ask yourself, is it true? Is it necessary? And is it kind? And I would ask you to ask yourself those questions first, and then move forward with your answers as you go beyond that. The second thing I wanted to talk about is your sense of purpose, and knowing what that is, and pursuing that. And if you're not sure, taking some time to move into that space. This is what I call soul satisfaction, and it's where sometimes when you're feeling down or distressed or anxious, if you help someone else who's also feeling that way, you will actually find that your anxiety and your stress goes down. So helping others is a great way to relieve that, and also to start discovering your purpose. And that brings clarity to so much other confusion in your life. And it helps you also with a sense of belonging. If you know each morning what your meaning is when you wake up in the world, and what you're supposed to do, that you belong in the greater sense of it, that brings us to a grounded, calmer state. And I consider that really powerful medicine. Knowing who you are and how you exist and what you contribute to the world is one of the best things you can do. The third thing I wanted to talk about is balance. And creating balance in our life is probably one of the most challenging things to do, because there's so much coming at us in so many ways all the time. And it's just about avoiding excess. And some of you are maybe familiar with this term. It's called orthorexia. And it's an obsession with health. And that can be bad as well. So we want to obviously be mindful of the things that are healthier habit-wise and for ourselves, but at the same time, not going overboard with it, to the extent of you can't even go out to dinner and socialize because you're obsessed with the food won't be right, or the environment will be damaging to you. So it's thinking about where that goes. And this is actually a really nice handout. I want to give credit to our new partner, Tina Duffy, as a health coach. She brought this to my attention recently, and it's called the Wheel of Life. I don't know if you can see it specifically, but this is something that I really recommend people do. And it's, I'll just read you the categories real quickly. It's joy, spirituality, creativity, finances, career, education, health, physical activity, cooking at home, making meals, home environment in general, relationships, social life. And so you go through and you rank how you feel on all of those topics, and then you draw your own wheel and see where you have a flat tire, basically. And that allows you to put your energy into the areas that you feel like you need to uplift, and not keep putting your energy into stuff you're already really good at. And so if anybody wants a copy of this, We can try to get one for you. Let us know. But it's just something to think about, where you can figure out where the balance or imbalances are in your life and focus there. Because if we keep spending all our time doing all the stuff we're really good at and ignoring the stuff we're not doing so well at, we stay out of balance. So that's one way to look at it. The next thing I wanted to talk about is nurturing relationships. And the topic of today leads us to think about first nurturing your relationship with yourself. And a lot of times I find that if we don't like ourselves, we're not going to like others very well. So we have to identify where we're at in that side of things. And interestingly, there was a study done at Harvard University that lasted 8 decades, and they looked at over 1,500 participants, and they found that the relationships in general were the key to happier people and contributed to all of the other arms of health. And so the relationship with yourself is where we start, but it can also be with, with your family, with your friends, even with animals, with pets. Having positive, engaging, uplifting, nourishing relationships is just as important as the food that you eat and the way that you prepare. So I ask people to think about that in my own consultations with people, because I know when relationships are off, it's very difficult to do the other basic health self-care techniques that we talked about. And that's where we start letting those things go. So everything dominoes into everything else, and we can do it in a good way or a negative way. And then the last thing I wanted to talk about is laughter. And I think we tend to not laugh enough, and with movies being difficult to go to, you can certainly watch them at home. But laughter is really, really good medicine. It's contagious. Just like a smile. If you see someone smiling, you're more likely to smile back. If you hear someone laughing, you may actually feel more like joining in with them. There is something called laugh therapy, believe it or not, where the leader will actually start a really good belly laugh. I've been in a room in a conference where this happened. It was a big, big conference. And this lady came up on stage and started a laughing sound in the microphone. And I can tell you, everyone in the room just started laughing. And there wasn't anything said. So it wasn't like something funny happened. It was just this contagiousness. And after you laugh, you find that you've improved your digestion. You're going to sleep better. You'll have less stress. And you'll create a bond with everyone else that you shared the laughing in. So there you go, back to the whole idea of relationship building. Those are the tenets I wanted to bring up and talk about today, and remind everybody that the self-care buckets are something to pay attention to. What you do to maintain your health is surviving, and what you do to elevate and move to the next level of existence basically is thriving, and that's these wellness techniques. So if any of those resonate with you, share them with the people that you know. Share them by example. Share them by practicing. We all tend to watch each other, and the modeling effect is real. Sometimes it's more powerful to model than to speak, and that elicits the best change ever. So if you like any of these things, like I said, share them with people that you know that can benefit. And always reach out to your team of providers here at LifeScape. We're here for you all the time, and happy to support in any way that we can. And of course, I do the additional nutrition counseling with people who are not part of the LifeScape membership but would like some extra support. So if you know people who would benefit from that, feel free to send them over. And in the meantime, take care of yourselves. Have a fabulous, wonderful fall weekend. And until our next Facebook Live, be well.